Good afternoon. I'd like to thank the program committee and the panel for this unique opportunity to present for the very first virtual SAGES annual meeting. I've been asked to talk about how to become more involved in SAGES. SAGES really does rock, but becoming involved can be a little challenging. I have no disclosures to give other than I'm on the membership committee, and I believe we should all join SAGES. I've really enjoyed this topic because I have looked at my own career and life and my involvement in SAGES. There are so many ways to become involved in SAGES, and each with different time requirements and activity levels to match our busy and chaotic lives. Today, I plan to talk about the different ways to becoming involved in SAGES, from online courses, webinars, Facebook and Twitter social media platforms, participating in the annual meeting and hands-on courses, and becoming a committee volunteer and champion for SAGES at your local hospital. The first way to become deeply involved in SAGES as an organization is to join SAGES. There are many different levels of membership to include medical student, resident level, affiliated specialists, international membership, and active memberships. To start your journey, joining SAGES is the first step. By joining SAGES, you open the door to opportunities in education, leadership, and most importantly, friendship. I've made so many friends through SAGES that I can call for help when I have difficult cases or just need advice. The different memberships allow the whole team to be members, from nursing and physician assistants and nurse practitioners. Your membership can grow with your career through medical school, fellowship, and while you're a practicing surgeon. There are many advantages to being a SAGES member. These include discounts to the annual meeting, access to the educational material and video library on sages.org, and monthly subscriptions to the surgical endoscopy. And these just are a few. SAGES has designed many courses that have become part of residency training to include FLS and FES. While these courses provide the basic level of skills necessary for development into a career as a surgeon, SAGES does other courses for safety and practice, development of skills throughout career. FUSE, fundamental use of surgical energy, and Safe COLI program provide a means to improve knowledge to bring the collective education from SAGES to your institution. SAGES also produces many webinars for residents and practicing surgeons to improve knowledge of surgical topics. These courses are designed to keep your knowledge on common surgical topics and minimally invasive topics up to date. While courses are a passive way to be involved in SAGES, they are a way to keep in touch with the SAGES community and to expand each individual's knowledge of surgery and keep refreshed about surgical topics. The new era entered with COVID has shown how the virtual environment can be utilized to expand education, knowledge, and friendship. It also provides a means to interact with other surgeons that can provide knowledge to better help patient care. SAGES has developed closed, protected Facebook groups on many different topics. These groups are joined by thousands of SAGES members and elites in each category, but each individual can participate in these groups. These provide a nice way to learn from others in the community. It provides a way for us as a community to discuss the management of patients that are challenging. While the perfect answer, or even the best answer, hearing different approaches can provide a means to better manage patients. Increased involvement in groups like this provides a more active role in the SAGES community. Increased involvement in groups like this provides a means to become more involved in SAGES as an organization as a whole. Of course, one of the biggest ways to become more involved is to attend the annual meeting. While this year's meeting is meeting in a virtual environment, future meetings will likely be a combination of virtual and in-person. Coming to the meeting is like no other conference. During the meetings, it is, in addition to learning, meeting other surgeons and current leadership of SAGES is really the best way to become more and more actively involved in SAGES as a surgeon. Events like the leadership resident meetings, sing-off, provide a more casual environment to meet the current leadership of SAGES and to increase your involvement in the organization. There are also hands-on courses at the meeting to learn from leaders in the field about increasing skills in specific ways to add to your practice. As your desire and time availability increases, joining the SAGES committees is a significant better way to improve your knowledge, passion, and energy towards SAGES. SAGES is always looking for people to help with vastly complex organizations. SAGES needs people to help in administrative organizations in tasks like membership, bylaws, funding, and finance. SAGES is also active in advocacy, patient education, and outreach, even having a voice in policy. Finally, SAGES is involved in education of residents and creating guidelines, staying up to date on all aspects of surgery, including fundamentals of endoscopic surgery, fundamentals of laparoscopic surgery, and even other programs. SAGES committees exist in about every category of surgery. If you have an interest and a passion, your expertise is needed for SAGES. So volunteer to be on a committee and help SAGES become a better organization. How do I volunteer, you might ask? Once you are a member of SAGES, you'll have access to sages.org website. Under the membership tab, you'll see volunteer for a committee. Fill out the short form and let SAGES know how you can help. Then SAGES will reach out to you. As your career progresses, you can move from as your passions and knowledge change. Your unique skills can help SAGES become an even better and exciting and greater organization. Finally, becoming a SAGES champion. A SAGES champion is a direct link from your facilities to SAGES. It is a two-way directional communication from SAGES to your facility. You can provide your facility with SAGES information about safety and best practice methods. In addition, you can provide the needs of your facility to SAGES to allow the organization to best support you. You are an active person recruiting to make SAGES a larger and more diverse organization. In conclusion, SAGES truly does rock. It has allowed me to meet friends and colleagues from around the world to enrich my practice and my life. The best way to get more involved in SAGES is joining SAGES. The next step is volunteering to bring your talents to this wonderful organization. SAGES truly does rock. And I would like to, again, to thank the panel and the committee for allowing me this opportunity to speak.